And the International Diabetes Federation estimates that 285 million people around the world have diabetes. The disease is a major public health problem in Africa. Here in the United States, Mrs. Adeola Akindana is on a global crusade to raise awareness about the condition through her organization, Health Beam Outreach.
Diabetes is a pandemic that is going worldwide now. It's not just a Western world disease anymore. So it's something that I feel there's an urgency to let people know, especially even in the continent of Africa.
Now, when we talk about diabetes, we are looking at two types of diabetes. Which one is the more common that you tend to address in your practice?
Well, type 2 diabetes is definitely more common. We do have type 1 diabetes, and people who have type 1 diabetes, basically, they do not produce insulin at all, and they will have to take insulin for the rest of their life. And that's probably about maybe less than 10% of people, all the overall diabetes population. People who have type 2 diabetes, that usually comes on because a lot of times people are overweight, and so the body becomes resistant to insulin. So they're either not producing enough insulin to bring down their sugar, or whatever they are producing, their body is not utilizing it well. So you have well over 90% of the people who are type 2 diabetics. The third type of diabetes, which we don't often hear about, is gestational diabetes, and that's in women who in pregnancy develop diabetes. People who have, you know, back home, when you have a 9-pounder baby, they say, oh, the baby look like 3 months old, but really that's the first indicative sign that that mother needs to be tested. If you have any baby over 9 pounds, 6 weeks after delivery, you need to go back to the doctor and make sure that they test you, because that has really increased your risk of diabetes.
What are the signs?
When you start feeling very, very hungry, excessive hunger, excessive thirst, you go into the bathroom frequently, you're losing weight, you know, they have wounds that wouldn't heal, they, you know, maybe like a little sore all of a sudden becomes infected. Those are some of the telltale signs that indicates that there needs to be some kind of follow-up with the doctor and get tested.
And how do you manage the disease?
You could be treated with diet only. It depends on how advanced the diabetes is. Healthy eating, yes, which is introducing more vegetables, more fruits, you know, colorful foods, reduce your starch, rice, and bread, gari, all those kind of things.
But what you're describing, a lot of it is in the African diet.
Our food is very high in starch. You know, we eat a lot of starchy food, but really the most important is portion control is what we call it, which means that the amount that you eat. I mean, the way that I teach my patients is that when you have your plate, you want to divide the plate in half. And when you divide the plate in half, you want the one half to be some kind of vegetable. Then the other half of the plate, you want to divide that into another half, so that a quarter of what you're eating is the starch, and then the other quarter is your protein, which is the meat, fish, chicken, and things like that.
What kind of message would you like to convey, especially to the African population, regarding diabetes?
The thing is that diabetes is the 6th leading cause of death worldwide. Diabetes causes a lot of problems. It causes blindness, is the leading cause of blindness. It causes people to lose limbs, amputation. It causes end-stage renal disease, where people end up on dialysis. You know, it even causes heart disease, where people could develop a heart attack or stroke, and sometimes even death. So the complications are enormous, but it doesn't have to be like that. With a little self-control, a little push, it's an endless effort, but it can be done. And that's why you have the health professional team to assist the patient. They can live a long and healthy life.
And that was Adeola Akindana, certified diabetes educator. Dumiake, that's your health report.
Well, thanks so much, Linord. You know, the good thing is she ended on a really high and encouraging note that is really in our control. So that's good to know. Absolutely. As always, thanks so much, Linord, for always the latest health news. And for our audience, every Tuesday and Thursday, Linord is right here on In Focus, giving us the most important information.
Well, and for more information on these stories, go to voaafrica.com.